Just like an outsider's perspective, every once in a while you get that like shooting pain. And what is that? Is that somebody that still has their wisdom teeth? Is it just like random shooting pain? What's causing this?
Well, it's definitely random shooting pain. Okay.
So random.
I'm not quite sure what it is. That's why you have to come into the office. But if I were to guess, typically the top 3 reasons people would have some kind of random shooting pain is, one, they have a cavity that they're really not aware of, and it's pretty deep. It's heading to the nerve, maybe causing some kind of inflammatory response, and that's leading into tooth pain. And you'll usually typically see, sensitivity to cold, to sweets, with that type of nerve type of pain. It's more nerve pain.
Yeah.
You also see, tooth pain with the clenching that we just talked about. A tooth's out of alignment, or they're, clenching more on one side. That's when you're gonna get that kind of singled out tooth pain. Whereas, if they have a good bite, they've maybe had some orthodontics, you'll have overall teeth pain on most dentition. And then the other thing, people don't really remember or think about is you got these wisdom teeth. Over time, we just don't have enough space in our mouth for these teeth, and so they try to come in, they try to work themselves into the mouth, and then a lot of times the patients are feeling that pressure behind that second molar. Maybe they got bacteria stuck behind the back, and it's causing some inflammation, and typically it could be one of those two or three things.
Yeah, and we see that a lot on the orthodontic side, right? So teenagers, they go through treatment, they finish, we have the teeth and the bite, corrected and aligned the way that we want to. And now it's a matter of, how do we maintain those results for as long as we can? And that's where the retainers come in after orthodontics. But you still have a set of wisdom teeth typically that are there, that are still trying to move and find their way in. As Dr. Caroline said, most of the time there isn't enough room for those. So what we typically do then is have them go see the oral surgeon once they transition out of the orthodontic phase. The results will be maintained as long as they wear their retainer, but it's just one more layer. It's usually the time to take them out. There's an ideal time, right? When we're looking at it, kids bounce back quicker. It's an easier procedure for everybody at that age as well too. So that's when the typical referral comes to, let's go talk to the oral surgeon, see where we're at in the process. Are they ready to come out? Do we need to wait? What are we doing? And that's been great for us on the orthodontic side to also have that step taken care of. And now it's just wearing retainers to maintain the results as well too.
And is there a reason we don't just take out the teeth right before they start orthodontics?
So a lot of times, can I answer this? A lot of times, the teeth buds aren't even developed yet by the time they start their orthodontic treatment. And then during the orthodontic treatment, with the series of x-rays that we take, you can start to see the development of the third molars. And you try to time up, when are you going to go in and when you are not. And so for me, typically, I like the teeth to drop in a little bit more. It's less pain on the back end in terms of post-op recovery. So I like the teeth to be in a certain position before I take them off. So sometimes Kurt will send someone to me, I'm like, hey, let's wait one more year and we're going to pop these out. Right? Because post-operatively, it's going to be a better situation for you than instead of me going way up there and digging around, right? But the idea is to catch it before they're out of orthodontic treatment and then they go off to college. The second they go off to college, they're going to tell their mom and dad they're wearing that retainer, and I'm not quite positive that's happening. I mean, I didn't wear mine, so guilty. So I think, when you think about those things, you got to think, okay, when are we going to take this out? So parents, if you're looking at timeline, and I know financially that's just another step in terms of, something else to pay for, but a lot of our patients, the ones who are a little more financially constricted, they'll come in, they'll see Kurt, they'll make their payments, they'll finish out their payments, and then they'll come in and they'll make their payments for their wisdom teeth. And then it's nothing stressful for them in terms of monetarily speaking, and they know the process and they know that's coming up and down the pipeline.
Yeah. And I like the fact that you guys have financing options. I think that's huge for a lot of families, especially if they have multiple children that are in there and doing ortho, or they need their wisdom teeth taken out, or just general dentistry as well. But I've seen that help a lot of people. So I can only say how much that I appreciate just seeing that with treatment plans. Yeah.
And I always equate it to, in a previous episode, we talked about the phase 1 treatment for orthodontics. It's similar with the oral surgeon. It's that initial screening to see, do you need to get these out now? Or do we need to wait for a little bit because, as Dr. Caroline was saying, maybe they are not developed enough yet?
Yeah.
But some of the issues that we see is if there isn't any room for those wisdom teeth to come in, they have the potential to do damage to the teeth that are in as well. And so that's why for us, it's just, that's part of the process, is not that we're going to get them out, but we're going to have you see the oral surgeon so we can plan this out and take care of any issues in more of a preventative, which we're big on as well too. How much of this stuff can we do preventatively instead of dealing with a bigger issue later as well?
Absolutely. Random question, just because we all know that when you take your tooth out, then you kind of deal with bone loss. How is it different for wisdom teeth?
You will 100% get some bone loss, but it's in a spot which you really don't care about. Like, you know, most of the teeth that I'm taking out, you know, when you look at the jaw, you know, the jaw shape here of the jaw, you want most of the teeth to be in this lower part of the jaw. This is where you want all the teeth. You don't want anything up in here. And so when I'm taking out wisdom teeth, majority of them are sitting up in here. And sometimes by the time I do get to them, they already have bone loss because bacteria and food products are getting stuck in there and they can't even clean it.
Right.
So yes, you're going to get the swoping little bit of bone loss behind there, but who cares? We're not putting an implant in. You know, like no one's going to care as long as the bone behind that second molar is preserved, which is what we do here. So in terms of what you're talking about is more about implants. And when we take out like a front tooth, we take out a premolar, canine, what have you, we'll do some bone grafting there at that point to do to preserve that bone, or to make sure as an insurance policy that, hey, I know when I come back in a couple months, maybe 3 or 4 months, that I do have bone to work with. There are cases though when I do put bone graft in wisdom teeth, they're usually my older patients. Children can form bone like this. So like when I remove that wisdom tooth back behind that second molar, there'll be good bone formation within 3 to 4 months. In an adult, someone who's 32, there may be a chance that I don't form that bone, or maybe if I know when I remove this tooth, there's going to be no bone behind that back molar there, and I don't want to just leave that. And so then that's when in that consultation I'll say, hey, you know what, like why don't we add some bone here? Let's just make sure that when you heal, you'll heal correctly, and you'll have some bone behind there. And then we combine that with PRF, which is platelet-rich fibrin. That's when we take your blood, spin it down, and we add all these good growth factors to the site and decrease the amount of dry sockets and increase the bone conversion. So.
Yeah, that liquid gold.
The liquid gold. It is gold.
It is beautiful.
And it's their own gold. It's their own body.
Exactly.
So that's another.
We're made of gold.
It's no one else's gold. It's their own gold.
All right. Yeah. Okay. Well, I guess this concludes our 3rd episode of Teeth Talk, and I just like to thank the Casers for being here today. And if you can like and subscribe below, that would be awesome. Or give our office a call at 520-290-8787.
Thanks again.